specialty doctors, or as they're also known as SAS Doctors, are a key component of our workforce. They're senior doctors, they have significant subspecialty experience within their specialty, and they provide a key component of healthcare within our teams. A lot of our junior doctors rotate through the service. The specialty doctors provide a continuity of service which is important for patient care. I suppose there's many other aspects that we would value also. As senior people within the team, they're involved in the delivery of education for multidisciplinary staff, for medical students and for other junior doctors.
Specialty doctors, previously known as staff grades and associate specialists, make up 20% of the UK medical workforce. They are senior clinicians on substantive contracts on national terms and conditions. The majority have more than 5 years postgraduate training and 80% have more than 10 years postgraduate experience. 68% have membership exams and 77% have at least one postgraduate qualification, so they're a highly skilled workforce. After medical school, doctors enter 2 years foundation postgraduate training F1, F2 before proceeding to specialty training to become a hospital specialist or GP. After 3 years they can become a GP, after 5 to 8 years they can become a hospital consultant, after a minimum of 2 years they can become a specialty doctor. From April 2021 can, with a further 10 years experience, become a specialist. Collectively they're known as SAS Doctors. They may choose to remain and develop in the grade, return to postgraduate training or apply for the Certificate of Eligibility of Specialist Registration to become a consultant. GPs often develop special interests and can work sessions in hospital as SAS doctors, for example in the emergency department. Some consultants choose SAS grade for work-life balance, and any doctor can work as a locum or trust doctor. All senior doctors have to meet the same GMC and continuous professional development requirements with annual appraisal and revalidation.
I've been an SAS grade now for 10 years and I started after my specialty training in oral surgery in 2010. My working week looks like it's a very busy week. It obviously moves around a bit, so I do a full day in Downpatrick where I have autonomous practice with a new and review patient clinic and a day surgery general anaesthetic list in the afternoon. Then as the week progresses I have some clinics back here in the Ulster Hospital, followed by a paediatric day surgery list on a Friday morning here in the Ulster as well. I have a number of other roles within my job plan, which include that I'm the training programme director for the dental core trainees, which is something that I took on about 5 or 6 years ago, having been an educational supervisor before that. So I'm the training programme director for all 22 dental core trainees here in Northern Ireland, across all sites from the Belfast Trust to the Western Trust and back here to the Belfast and South Eastern Trust. I've also had the opportunity to sit on regional Never event group, which affords me insight into how other departments work and helps me when I'm looking at quality improvement within our own department, that we're sharing our learning across trusts and departments. So I very much enjoy being part of that, and I've had a lot of opportunities to do things like that with the support of the trust here and with the support of my colleagues, and that's one of the advantages to me of being a staff grade or a specialty doctor, that I have a little bit more flexibility in my time to take up these roles and opportunities.
The reason I became a specialty doctor is the opportunities that I've had provided within the trust. I've had the opportunity to undertake my Masters in Business Improvement, which is an area that I was interested in learning more about, including how healthcare is provided within Northern Ireland. Locally, I've had the opportunity to undertake my echocardiogram training, and I'm currently undertaking that with the help of the Cardiac Investigation Unit here based in Lagan Valley. From being a specialty doctor, I've had the opportunity to be involved in quality improvement projects and have had the opportunity to lead with our heart failure nursing team here in Lagan Valley the development of an ambulatory diuretic service. This provides a great alternative for inpatient admission for patients, and from being a specialty doctor I feel being located in one place has allowed me to get involved within these opportunities. I'd really promote the career to anyone who's thinking about it. It provides great work-life balance and also allows you to clinically develop and also professionally develop as well.
We need to work closely and involve our specialty doctors within our service delivery units within the team. They've got key ideas from the front line that we have used in the past to reshape some of our services, and that is important. I've always felt that they've had a voice at local negotiating committee and other committees that they sit on, but I suppose we have to grow that voice. So they are an important portion of our workforce. We have probably over 100 specialty doctors within the trust. We value it, we need to develop it further, and I'm looking forward to them getting involved, I suppose, in leadership roles and developmental roles within our service within the trust.
The main advantages of an SAS career are work-life balance, geographical stability, career flexibility, the opportunity to subspecialise, and we now have a bespoke leadership and professional development training for SAS doctors starting January 2021.